So your doctor just prescribed mycophenolate. Maybe you've heard it called Cellcept or Myfortic. And I bet you have a ton of questions. Well, you've come to the right place. Over the next few minutes, we're going to break down everything you need to know. Look, starting a new and powerful medication can feel, well, like a lot. It's totally normal to feel a bit overwhelmed. So let's just start at the very beginning with the most basic question. What exactly is this stuff and what is it supposed to be doing? All right, first up, let's get into what this medication is all about and what it's actually doing inside your body. Okay, so mycophenolate is what's called an immunosuppressive drug. Now, I know that sounds kind of intense, right? But its job is actually pretty targeted. The best way to think about it is like a volume knob for your immune system. It's not shutting it off completely, nope. It's just dialing down the activity, just enough to calm down that harmful inflammation and, most importantly, protect your organs from long-term damage. And you might be surprised by just how many different conditions it's used for. Doctors prescribe it for autoimmune diseases like lupus, rheumatoid arthritis, vasculitis, you name it. It's also used for things like inflammatory bowel disease and even some skin and eye disorders. And it's a huge deal for organ transplant patients. I mean, it plays the absolutely critical role of stopping the body from rejecting a new organ. Okay, so we know what it does. Now let's talk about the practical stuff, how you actually take it. Getting this part right is super important for it to work. And the good news is the routine is pretty simple. It's just a pill, and you'll most likely take it twice a day. And here's a nice little bonus. You can take it with or without food. So that gives you a bit of flexibility in your day, which is always great. Now, what about the dose? Well, for most adults, the total daily dose usually ends up somewhere between 2,000 and 3,000 milligrams. But, and this is a big but, this is not a one-size-fits-all situation. Your doctor is going to figure out the exact dose that's right for you. They might even tweak it over time, depending on things like how your kidneys are doing and how your body is responding to the medicine. All right, let's tackle the big one, side effects. Look, it's just a reality with pretty much any medication, right? And the best way to handle it is just to know what to look out for. That way, you can manage things without getting freaked out unnecessarily. So some of the more common things people report are things like nausea, maybe an upset stomach, some headaches or dizziness. You may also notice things like trouble sleeping, some tremors, or even a rash. Again, the point here isn't to scare you. It's just about being aware of what could happen. And because this med is working on your immune system, your doctor's going to want to keep a really close eye on what's happening inside your body. That's why you'll be doing regular lab work. They'll be checking your blood counts and how your liver is doing. This part is like totally non-negotiable. It's all about making sure you stay safe. And that brings us to a really important point. We need to draw a clear line between those common side effects, the things you just kind of monitor, and the more serious stuff that means you need to pick up the phone and call your doctor right away. Okay, let's shift gears. This next part is all about the crucial safety warnings. These are the big red flags. If you see one of these, you stop the medication and you call your doctor. No hesitation. First up, number one, infection risk. Because the medicine is dialing down your immune system, you're naturally a bit more vulnerable to getting sick. So the rule here is super simple. If you get a fever, a cough that won't go away, or any other sign of an infection, you stop taking the med and call your provider. Period. Okay, this next one is incredibly serious, and there is zero wiggle room. Mycophenolate causes severe birth defects and pregnancy loss. That means you absolutely cannot take it if you are pregnant, trying to get pregnant, or breastfeeding. It's so important to talk with your doctor about effective birth control while you're on this. And last but not least, let's talk about vaccines. This is a big one. While you are on mycophenolate, you have to avoid all live vaccines. So what's a live vaccine? It's a shot that has a weakened but still living version of a virus in it. The rule of thumb, always, and I mean always, talk to your rheumatology team before you get any vaccine. So you've got all this info now. What's next? How do you make this all work? Well, the secret is partnership. This isn't just about you passively taking a pill. It's about you being an active, informed member of your own healthcare team. Think of this as your checklist for keeping your doctor in the loop. You got to let them know about any signs of infection, any weird diarrhea, or if you're bruising or bleeding more easily. Also things like shortness of breath or any allergic reactions. And it's about the big picture stuff too. Let them know if you've got surgery coming up or if you're even thinking about pregnancy. And really, that's what it all boils down to. The whole thing works because of that partnership. When you have open, honest communication with your healthcare team, That's how you make sure you're getting the absolute safest and best care you can. So we've covered a lot, right? The what, the how, and the why. But the goal here wasn't just to dump a bunch of information on you. It's to help you feel more in control. So I'll leave you with this question. Thinking about everything we just talked about, what's one thing you're going to ask at your next appointment? Because your health journey is a conversation, and you're now more than ready to be a part of it.